Good morning, everyone. Thank you so much for joining us this morning. It's a Monday morning, and still you guys have taken out time to be here on time. So I really appreciate all of you, sirs, as well. Uh, we are living in a day and age where technology has not just made India proud for its IT, but the impact that it has been creating in the business of healthcare has transformed and brought India in the global arena. Today, we are proud that the world does not know India just for its IT, but it also knows India for the impact it is creating in the global healthcare space. But the role that IT is playing in healthcare is something that we cannot ignore. And that is the reason we chose this topic to take understanding of all of you to know what is the kind of impact that we are creating when it comes to healthcare. Dr. Pankaj Gupta, my first question would be to you that the new buzzword in healthcare is AI, ML, big data. What is the biggest transformation that we are expecting to see in the healthcare industry in the near future?
Thanks for having me here. And I get the pleasure of starting this panel discussion with the first question. Lots of people talk about telemedicine and related things happening a lot in healthcare in the last couple of years. It got accelerated in terms of adoption. What we thought will happen in 10 years has happened already in the last 2 years. In my perspective, there are three fundamental shifts that have happened. One, there is a technology shift. So from the erstwhile client server enterprise class, we moved into something called SMACI. SMACI being social media, mobile, analytics, artificial intelligence, cloud, and IoT. Now, this is a fundamental shift because it's a mobile first, cloud first technology which has come in. You don't design for the desktop any longer. And this has happened in healthcare. And you design for the mobile. You design for the cloud. It can also work on the desktop, but you design for the mobile and the cloud. So that's one fundamental shift. The second is a business shift. So earlier it was, a license-based model. Now you have shifted to a pay-per-use model, just like a utility. You pay for your electricity, you pay for your water, same way you pay for your software in healthcare. So that is the second fundamental shift that has happened in the pandemic in the last 2 years. And it will continue, it is going to accelerate. It's going to become, the aggregators will come into play and all that. Just like, Anurag was talking about Amazon getting into healthcare. The third one is the policy shift. Now, especially that has happened in India, Modi government has actually made the policy shift to support all of this. The National Digital Health Blueprint is fundamental premise is mobile first and a cloud first. So these are the things that have happened, and they're going to carry, the mission forward in terms of making it global. And very well said that India is poised to become a global leader in healthcare.
Absolutely. I think it's a very beautiful point that you brought in, because I've heard that in technology conferences and internet conferences, when we talk to the startups, they're talking of going mobile first. But today, I mean, if you look at the products that are displayed outside, these are all handheld devices and which give you the information in your own comfort. Dr. Mahajan, how has the business of diagnostics evolved using technology? And from the perspective of equipment we use, the analysis of data that we see, the outcomes that we can create, how has the diagnostics business changed or evolved, keeping technology in mind?
Thank you very much for that question. I must compliment my co-panelists for putting things so succinctly, so clearly as to the shift. He's put it so well, left nothing out. And now in the diagnostics industry, as doctors, we are still reluctant to call medicine as a business, even though it seems the world has come around to using that word. As a practicing radiologist, it still, rankles somewhere. But be as it may, we have to move with the world. Now, in diagnostics, technology in the last 3 decades has played a major role. If we look at lab medicine, pathology, from a pathologist actually doing the pipetting, looking at things, trying to see the color and figuring out. Today, we've reached a stage where thousands and hundreds of thousands of tests are run automatically on machines. Of course, you have to take care that all the standards are maintained, the controls are put, and one pathologist may be signing out 5,000 reports in a day, which may have been 50 or 100, even 20, 25 years ago. And these, if your controls are put, if you are maintaining standards, by and large, you would be getting accurate results. So that's a transformation which has happened because of technology in lab medicine, in pathology, where today, you are able to accommodate in one center so many tests. And also because of that, pick up these samples. The hub and spoke model has really come into its own because of the march of technology. Would not have been possible otherwise. Now, if we look at radiology imaging, we were always, technology enabled right from the beginning. It was always digital. What has happened again is that with the expansion in the computers and the uh, uh, advancements that have occurred in that field, today we are able to do very high resolution scanning. Scans like I started doing MRI scans 35 years ago. It would take 1 hour to do one scan of a patient. And with the matrix sizes or resolution, which today, when I even think of how confidently we used to write the reports at that point of time, it was the best available at that time. But still, when you look back, you marvel at how much of a I would say risk we were taking in calling small lesions and all of that. Now, today, what I'm able to do in 15 minutes on an MRI scanner, it would have probably taken me 5 to 6 hours to scan one patient. And there's no way that even in 1 hour, a patient tends to move. So think of that. So that has enabled uh, us to diagnose illnesses, diseases, which was just not possible earlier because of advancement of computers, computing power. Each one of us carry a supercomputer of old in our pockets. And so that's the transformation. So what has happened is that our throughput has increased. Um, Also with this, today with teleradiology, telemedicine, one is able to do, in underserved parts of the world where radiologists may not be there, images can be brought very easily, and it's become very cheap also. When we started 20 years ago, those lease lines cost a packet. Today, it's become very, very cheap. So there is what has happened with technology is this democratization of healthcare, of quality healthcare that has happened. Um, of course, there has it, always been this problem with the affordability in our country. And that's where I think technology, the new AI systems that are getting available, will not only improve quality, not only improve turnaround times, but we hope will also reduce healthcare costs and be able to fill these specialized manpower gaps that exist not only in this country, even in England or the US. There is specialists with the advancing reach of diagnostics. The number of specialists can never keep pace, and we hope that AI will be able to help in that field. I mean, I could go on, but I think without technology, diagnostics would not exist as it exists today. And also, with technology has come improved and better and more accurate diagnosis, and frankly, marked lowering of costs, even though we may find it not affordable.
Uh, that's brilliant, Dr. Mahajan. What I hear you say is that in an industry which has always been using technology, that's been the baseline of the way it operates. The biggest challenge that we see in terms of accessibility and affordability, technology is playing a role. It just reduces the dependency on people. And much as we don't like calling it a business, but it is still an industry and it has to sustain itself. By reducing the cost, it is also making it affordable for us as users, end users. So,
If I may just, you've touched on a very important point of not only affordability for the patient, but also viability for the
absolutely,
provider.
absolutely.
So that's one thing we cannot lose sight of, that even though we want every best technology in the world to be available, but at the same time, we should be willing to see that we are able to pay for that, even at 1/10 of what it costs in the West.
Absolutely.
We are able to survive and thrive, but it should not be that we somehow kill the sector itself.
Absolutely.
Because of the fact, especially for those who pay out of pocket, actually end up subsidizing those who come in
Absolutely.
various schemes. So viability,
It's very,
along
very
with affordability,
extremely-
has to be kept in mind.
Absolutely, absolutely. Mr. Mathur, when the technology starts playing a role that it impacts the particular industry, a lot of these startups keep coming in, and they start, entering the sunshine industries. What, as per you, is the key aspect that is fueling the investor excitement that we see in health tech today?
Thank you very much for inviting me and the question. In my perspective, technology has changed a lot of methods and concepts which were used in healthcare earlier. And that means that it is able to reach much more number of people. Doctors are able to connect to their patients in a very different manner. And patients or their families are able to, receive healthcare in a very different manner. And which means that technology is enabling the entire healthcare industry to keep evolving into places, into areas where it was not there before, and also moving out of very, very high-end specialized hospitals and areas to much, different environments, settings, moving to diagnostic centers, moving to clinics, and also in some areas where it's possible, moving to homes. Because of that, there is a lot of reach of healthcare which is improving, and that means that the number of people who can receive healthcare or focus on their wellness or focus on improvement of their health is really increasing. In any industry where technology is able to transform the way and make it easier to use or easier to consume, that industry will evolve and move forward. We have seen this in the past, several years back in the aviation industry. We have seen it in the banking industry in the last 15 years. Today, nobody visits a bank actually. And we are seeing a lot of this in many other sectors in industries, various other industries. And in the last 5 years, we are seeing this in the healthcare industry. where while keeping the clinician focus completely there, technology is able to really transform the way clinicians can use the technology, the patients can use the technology, and also the entire equipment providers, technology providers, and manufacturers are able to become an interface between a patient and a clinician. From an investor's perspective, the more number of people who can receive this care and get connected, on the whole concept of healthcare, the investment interest will increase, because investors or any large organizations across the world would like to focus on any industry which can cover a lot of consumers, which can connect to people, and which can focus on welfare of the society as a whole, while generating good clinical outcomes and various other technological aspects. So that is what is driving in health tech. We have seen in the last few years, you mentioned about startup. I come from a startup myself, which is Medikabazaar. Around 7 years back, there were hardly any companies like this. We are an aggregation platform, and we help hospitals, diagnostic centers procure equipment on online platforms. And that is something which is really becoming bigger and better, and becoming usable. As we move forward, all these platforms where where technology can play a role, many startups will come in these areas, and that's how investors will back them up and really promote the investments to fuel the growth of the sector. Uh, from clinicians' perspective, or from the perspective of doctors, it also brings a huge convenience and ease for hospitals, for procurement teams, for various other clinicians. Like Dr. Mahajan, my co-panelist, just mentioned that he used to do an MRI in an hour, and now he does it in 15 minutes. Of course, technology is enabling it. Similarly, maybe he used to spend about several hours or several days studying about equipment technologies, while today there are aggregation platforms which can do it in minutes and help them. Similarly, many manufacturers who were for whom it was difficult to reach out to small customers, small clinics, nursing homes in tier 2 and tier 3, 4 towns, can reach out to them through aggregation platforms, online platforms, and so many other media. Patients are buying drugs or medicines, prescription medicines online, and using this technology. And so are doctors, large hospitals, medium hospitals, and small hospitals. So, in summary, I think startups will flourish more and more because technology is evolving. We are, I think, at the tip of the iceberg in technology in healthcare, while many other industries it's very mature. So there'll be many more startups, many more investments, and lot of more technology coming on our way, helping the patients of globally and in India. Thank you.
You know what? With every challenge, there comes an opportunity. We've seen that in the pandemic. We've seen the startups and the founders getting excited and feeling for the first time that there is an opportunity in healthcare, because otherwise they were always struggling with this one question: can we scale the business? And what startups actually do is that they bring in two values. One is that they bring in efficiency. So sometimes you do not have to disrupt and displace something to replace with something new. You can always build efficiency in what has already been happening. And we've seen that across every aspect of healthcare. And the second thing that they do is they fill the need gap. And what we've seen technology do is that it has brought or bridged the gap between care seekers and care providers. With that, I come to the next question, Mr. Shantaram. One of the gaps that the technology is bridging is the access of healthcare to tier 2, tier 3, which means remote monitoring systems. So my question is, has digital delivery using health tech led to increase in efficiency in remote monitoring in remote areas as well? And has it brought the world closer and more accessible to healthcare services?
Thank you so much for that. And it's my honor to be a part of this panel. Um, and thank you for Business World and Heal Health to give this opportunity. In terms of the remote monitoring, I would say absolutely. I mean, I think technology, which Pankaj also alluded to, going mobile is one of the best ways where you see remote monitoring take a big fillip in terms of moving to remote parts. And, India, if you look at, there are 2 or 3 technologies where we have leapfrogged the West. I mean, one is in terms of communication, right? I mean, we moved away from cables directly to wireless, and that has enabled, and Geo with its low cost, we are probably today one of the lowest cost wireless, your Wi-Fi providers in the world. I mean, and so that's the speed of data that we are able to provide to all the remote corners of the country. So given that we have the technology and we are mobile enabled, I think it has helped us do the remote monitoring. Of course, I come from India Health Link, and we have HPOT, a kiosk, which also helps. It's the confluence of physical and digital. In fact, we have it outside here, which I would advise all the participants here to go and take a check. In 5 minutes, you get your full checkup of 20 vital parameters. And what you see is that these kind of technologies, right, which, are able to work in remote areas where you have issues with power, where you have issues with connectivity, where you have issues with local language. I mean, so you need technologies which are able to communicate in local language, which are able to connect to the Wi-Fi, which have enough and more backup built in to cross the remoteness of these areas. I think that's where technology helps. And I think we are very much there.
So, Mr. Shantaram, you brought in a very important aspect, which usually gets ignored, that sometimes the development of technology is not just about the technology for healthcare. It is the technology around that enables that technology. For example, the access to broadband and the telecom and the access to the supercomputer, as Dr. Mahajan said, in our pockets today, that has also helped where we are today. Dr. Mathur, I want to ask you one more question. That do you think with the government initiatives such as Made in India and Atmanirbhar Bharat, we are back on emphasizing more towards R&D than simply importing stuff from abroad?
I think that's very true. In the pandemic, we realized that unless you had it made within your country, you just didn't have it. There were so many competing, countries for the same products, and those who can pay more were the ones who were getting it. So the lesson was learned very quickly, and I think the government has done very well. It went into action, and the industry galvanized itself. And if we talk of just the masks and the PPE kits, I remember at that time we had reached out to Medikabazaar when the pandemic started, and N95 masks were just not available. Each and every N95 mask in this country had to be imported, and they had, they were nice enough because of our friendly relations that we got 500 of them at 500 rupees each. 500 rupees each. And we had to beg for it. From that, our exporters of garments, the textile ministry actually got into action along with the health ministry. And today we are net exporters of PPE kits and masks and all sundry such items. It's become a $1 billion industry. So, I mean, this one example, today you can buy a N95 mask for 20 rupees. And, PPE kits, which at that time were just not available. In the beginning, I remember we paid 2,000 rupees for them, even when we got them. Today, 200 rupees. and we are exporting, getting foreign exchange in. And also, please remember, our quality was very high. There were times when those that were imported from China, we could not use because of quality issues. Here, quality has been maintained. Similarly, with the, medication, and also, most importantly, the vaccines. Would we have had any access to vaccines if they were not manufactured in this country? And also, of course, the Covishield was something which was developed outside and we manufactured it. But with Covaxin, this was indigenous vaccine, and there are so many more. So what happened with the enabling atmosphere that was created by the government, with the public and the private actually coming together? This was one time when we saw that the trust deficit that generally exists just vanished. And we were standing shoulder to shoulder, walking hand in hand, and vaccines, so many other areas. Uh, but I think these lessons we've learned from the pandemic need to be sustained, and we need to look at other areas. Not that the government didn't have a Make in India, project. It was there much before that, and I can allude to one of them, which I'm a part of. This is the Make in India MRI system, which is under the Ministry of Electronics and Information Technology, and with 5 major government research institutes. Last 6 years, I think we've been able to reach a stage where at least at the component level, we have it all made. Now, the magnet, which is very tough. I mean, I can tell you that Samsung 10 years ago wanted to make a MRI scanner, and about 4 years ago, they gave it up. But I think another year and a half, we would have a product which then can be taken by the industry. So we should, I think, not only think small. Okay, the startups are great. They come up with new ideas, disruptive technologies, but also existing, technologies which are there. Because then if something is made in India, and if we maintain the quality, it will definitely be cheaper. And hence, making healthcare more affordable. So I think the government has done well. Also, the public and the private sector and the academia. Somehow where we lack is the industry and the academia coming together, as it happens in many parts of the world. Israel would not have been what it is as a leader of technology. Similarly, Germany, US, UK, unless the academia worked hand in hand with the industry. And that's where I think things still need to be improved.
That's a brilliant point. Mr. Mathur, since you are the one who's aggregating the manufacturers, distributors, etc., and making technology or medical equipment and supplies available to the industry, what is the difference that you have seen pre-pandemic and post-pandemic, when manufacturing kind of took off from frugal development to quality products being made, and then the government's initiative of Made in India and the PLI scheme? What is the shift that you are seeing, and are we really maintaining the quality?
Thank you. What we have seen is that manufacturers are investing a lot and very keen to manufacture in India. This was not there before pre-pandemic, because there was an easier way out. There was imports possible, and there were hardly any government, incentives or initiatives which were promoting local manufacturing. But now, because of the PLI scheme and because of many other initiatives which have been rolled out in the last 5 years, there is a lot of focus on manufacturing in India. Your question was, is quality maintained? I think there is significant quality being maintained by manufacturers who are manufacturing in India, since they are focusing on products which are possible, Indian manufacturers are not trying to do things which are or launch products which are premature and which are not finished in quality, unlike many other countries outside India. Uh, uh, Most of the manufacturers that we are aware of, uh, they may be working on complex products, but they wait. They are doing the real, high quality production possibilities, doing the testing, and then only waiting to launch the products. So quality is being maintained. I think we are already at a very high quality level in syringes, in PPE kits, in masks, and as Dr. Mahajan mentioned, a lot of accessories, which includes many products which are used in hospitals. We are at a very high quality level. In equipment, in many equipment which are ECG diagnostics, defibrillation, and ventilation and patient monitoring and such kind of products, we are also at a good level of quality in India. And some of these are better than world-class global products. In high-end, very high-end products, I think there's a lot of work going on all across with various clinicians, with various government partnerships, collaborations, and in a few years from now, we should be able to uh, have good products rolled out in those aspects also. On reliance on import, uh, especially for the basic accessories and basic products which are required, the reliance is really going down as the day goes, because more and more manufacturers are able to produce high quality, high volumes here. On equipment, we are still relying on a lot of imports, and that is something that the whole industry, which includes the government, manufacturers, and all the clinicians, have to work together to see how we can bring up the quality of high-end equipment in India, so that our reliance on imports goes down, and then we can really get down to better pricing levels and better access level for the patients in India. Thank
So
you.
I think, that's a very proud statement. It makes me proud that, we are bridging this gap. And also, it's not just that we are able to manufacture something in India, but we are also able to match, or even in many cases better, the quality of the products that we are making accessible. And, one more thing that we must also remember, that while until very just before pandemic, we were all talking about the world becoming smaller, things being accessible, कुछ भी कहीं से भी मंगा सकते हैं किसी टाइम पे. We actually saw that all kinds of transportation, etc., could come to a standstill, and that is where dependency can really be a factor which deters, the supply of products, etc. Dr. Mahajan, you wanted to
Yeah.
say something?
Just one quick comment. 10, 12, 15 years ago, the slogan used to be Make in India for India. Today, the slogan is Make in India for the world. And that itself has led to this transformation. So the quality has to be of international standards. And I think the youngsters who are coming into manufacturing or med tech or any other technology, they are aware of it. The whole world is now our market.
Yeah. And the absolute reason why we are all sitting today is to discuss how can we not just be at par with the world, but how can we be the leaders in healthcare, showing the journey, showing the path to the world. Mr. Gupta, since you've been involved with the Ayushman Bharat thing and you're an advisor to them, Ayushman Bharat scheme is one of the game changers that has been introduced in India, and for many reasons. But every scheme, every policy comes and it achieves certain things, but it also misses certain things. What are the key hits and misses in your mind when it comes to Ayushman Bharat?
So you're putting me on the spot. Well, so in terms of hits, I think all the right things are in place. So the policy is there in place. And then if you look at under Ayushman Bharat, the 4 pillars, as it's called, one being the digital health mission, the second one, the PMJ, which is the health insurance or the assurance scheme, the third being the health infrastructure mission, and the fourth is the health and wellness centers. If you put all of them together, and they work hand in hand, then technology gets into pretty much everything that you have to do, from health insurance to the provider to the primary care. So everything across the board. So it's the same platform, technology platform that services the public sector as well as the private sector. So that's the intent, to sort of bridge the gap across the board. So that's a hit. Now, in terms of misses, I think it's not really misses, but we are taking a quantum leap forward. Now, when you take a quantum leap forward, there are bound to be capacity gaps. So we have to do capacity building. A lot of capacity building on digital health, a lot of capacity building on health insurance, a lot of capacity building on health infrastructure. Now, we don't have that kind of a education framework. We don't have that, and new education policy is in fact helping, because crossover skills will have to be built between healthcare and technology, between healthcare and insurance, and so on and so forth. So that's the very big capacity building gap that is there. The second one is in terms of the ecosystem. If you have to build the ecosystem, you have to bring the market together with the policy. They have to be accelerators. So you need to have market accelerators which will help the organizations come up to speed on the new things that are being put forth. And this will have to be not only just accelerators from a perspective of putting the standards in place and things like that, but also helping in procurement, because procurement continues to be a gap. Whether you look at private sector or the public sector, I talked about mobile first and cloud first. But if you look at any tender coming out, you look at any RFP coming out, it still talks about a turnkey solution with 50 crore turnover. Where is that going to happen? And it doesn't talk about mobile first and cloud first as a requirement. So those are the things that sort of need to change across the board.
So you touched upon education as one of the things. Now, we always find that there's a gap between the healthcare, the number of healthcare providers that we need in the country versus the number of doctors passing out or the experts getting trained. What is the government doing about this? And keeping in mind that the quality versus the quantity challenge that we'll face.
So quantity versus quality, I think if we want to be global leaders, we need to have both. It cannot be either, and there cannot be any compromise on either. So we will have to sort of, and it's not like, we have a long runway to take off. The time is now. We already as a country are the sixth largest economy in the world, going to be the fourth largest economy in the world. And, the time is now to sort of go to that level where we will have to have quantity and quality in the same sort of mix. So, yeah, that would be my answer.
Dr. Mahajan, when we are seeing a lot of foreign patients coming into India. When we go to the hospital or when we even go to your center, we see a lot of foreigners there. How has health tech and the improvement in the efficiency it has built in the healthcare system contributed to the medical tourism that we are seeing?
I think it's still not made as much of a difference in medical value travel as it has in other fields. We still remain, a broker-based, if I may dare to use that word, system where there are intermediaries, and okay, that may be a legitimate business for them to bring patients from one country to the other. We have attempted in the past, several groups have attempted to make it more cloud-based, more accessible. But I think till the time that the governments and the embassies, they get involved, and there's been some attempt made in that direction as well, but probably the pandemic disrupted that. It will have to be to some extent at government to government level, where governments are able to say these 500 institutions in India are good, or be able to categorize them. Also, there is this feeling that the foreigners who come, even though it is very cheap, yet they end up paying much, much more. If that is 20, 30, 40% more than what an Indian would pay, I think that's fine. And as long as they know that is what they are going to pay, but sometimes it can be very different. So unless we get our act together, and technology definitely can play a major, major role, someone goes on a website which is probably accredited by the government, maybe NABH can play a role in this. Some kind of accreditation, some kind of quality to be maintained at affordable price, which it is. We are much, much cheaper. I mean, quality healthcare we provide at 25, 30% lesser than our neighbors. Let's forget the West, or even forget, say, Thailand and other healthcare destinations. We are cheaper than Pakistan, Bangladesh, Sri Lanka, and Nepal. And the quality we provide is very high. But I think still much needs to be done in this. And this can't be done by the private sector alone. The government would have to, maybe the External Affairs Ministry, along with the Health Ministry, would have to play a role, an enabling role. Not that they run the system, the private sector can do that, but they would need to be the enablers of bringing that system in.
Mr. Shantaram, I would take the same question with you. When you have people or patients from overseas looking at coming to India, initially it was just a phone call that they would make or try to get as much information from the brokers as Dr. Mahajan said, and then make a choice. But today, technology is beyond the medical devices and the health tech. The communication, the telecommunication allows you to be in a environment which is as good as sitting next to a doctor and speak with them. How is that changing, or how do you think will that change to increase the medical tourism in India?
Yeah, I think leading from Dr. Mahajan's statement, I think one is, like Dr. Mahajan said, the government needs to get in. And I think even Prime Minister Modi's address, as far as the August 15th Independence Day address was concerned, there is this increased focus on India being a destination for health tourism. Now, if you look at where we are today, technology, in fact, teleconsultation, just before COVID, was 1 to 2%, okay, of consultations. Post-COVID, it's gone up to 30%. So there is a greater and greater acceptance of technology. So in fact, even Anderson Horowitz, right, the VC firm, they said that what used to happen in health tech over 10 years has been accelerated to 2 years because of COVID. So in a way, we need to thank COVID that the mindset has changed. I mean, and that's a big one. So we have, excellent talent in India. And like Dr. Mahajan said, the cost structure is unbelievable in terms of. So I know for a fact that dental implant in the US, $5,000. Here it's 50,000 rupees. I mean, where is the difference in terms of the price point, right? MRI in the US, I paid $700 for an MRI. I mean, here it's less than $100 in terms of the MRI cost. So, the fact that we are able to leverage technology to provide that kind of inputs across the world. So distances become, irrelevant in that kind of a situation. So you're able to provide the consultation, you're able to provide the pathological inputs, you're able to provide, any help that is required for the patient to kind of tide over this one through remote technologies.
Yeah, I think I completely agree with you and resonate with what you're saying, because like work from home has transformed the way everybody is working. While teleconsultations have been available for a decade, but the acceptance wasn't there. But during the pandemic, we've all got used to, getting a consultation from a doctor without actually visiting them, and rely on that.
Sure, sir. The way the session is being conducted looks to me as if you are a teacher and they are the students attempting to answer your questions. They are addressing you only, not us. Second, with the advent of this technology in Medicare, that patient-doctor relationship has bending. It is gone. The patient who considered doctor as next to God is feeling weird. Doctors are not behaving like that. They are, wherever needed or not, they are referring to the diagnostic centers. They are not touching the pulse of the patient. For what fear, I don't know, whether they don't understand to read it or because of pandemic they are not touching. But whether required or not, the patient is being referred to diagnostic center for investigations. Rather than having that touch, rather than
So-
having that caliber.
I understand your question. Dr. Mahajan.
Let me answer that, sir. So the fact is that we are living in the age of evidence-based medicine. I mean, we have all gone to our neighborhood doctor who would give us ek lal shishi, ek hari shishi, and we would take it, and ठीक भी होते थे, नहीं भी होते थे. Our age expectancy was 36 when we got independent. We are at 70 now. Today, the problem is also with our training. When we were taught, we would touch and all of that. But then came technologies, diagnostics. Today's youngsters do touch, but we have gotten more dependent on diagnostics. You're right in that sense. However, think that if someone were to give you, touch you, feel you, hear your heart, give you medication, and you didn't get well, you know, instantly people tend to go to the consumer court. And the consumer court give crores worth of penalties against doctors. So in evidence-based medicine, everyone, the patient included, wants to know that if you're giving me this treatment or this medicine, why? What is the evidence based on which you're giving? Show me the test. In fact, half the time patients get the tests and go to a doctor. Ye to karai le, wo bolenge. So the entire scenario has changed, sir. Today, if you were to be given medication just by touch and feel or over the phone, you would not accept it unless it's some khasi, zukam or minor thing. More than that, you would want diagnostics. And then in this era of evidence-based medicine, litigation, medicine being considered a business and a commerce, there's no escape. This is how society has evolved. This is how medicine has evolved, and we have to live with it.
You know, I'll take a cue from that particular issue that has been raised and what you have just said. Technology and psychology are playing a role together. I mean, if you look at pandemic and what it has done, we have all become little more conscious about preventive healthcare because we realize that we need to maintain our immunity. We need to keep ourselves healthy just in case there's a challenge that comes up. My question to anyone who wishes to address is that how is technology helping us today to understand our bodies better and to ensure that we are healthier? And if there is a problem that is going to occur, we are aware of it and can handle before the challenge comes in. Yeah, please.
Yeah, that's a great question. And I think what you've seen in terms of our technology happening is also all the variables that have come in, right? I mean, they are giving you inputs on a regular basis, and this is going to the cloud in terms of your heart rate, your BP, and there are test kits that you get at home for measuring your sugar. So the fact is that even in India, we've been so far mostly curative in our approach, right? The fact that we can be preventive, and with the fact that, it definitely leads to much lower costs on the longer run, is coming in. And I think technology is a big enabler of that. Even the edgeport that we've put outside is an enabler in terms of showing the kind of diagnostics that you can take so that you are able to, take action much before the disease actually strikes you. So I think the technology is a great enabler for doing this in terms of what we see today.
I think just to add to that, AI is also evolving into predictive medicine. And Dr. Mahajan will agree to this, that there are a lot of research which is happening on artificial intelligence, which can detect what is wrong, but also really predict what can happen after a few years based on the conditions today. And that would really help, evolve into preventive maintenance medicine much better than what we are today. So that's how technology is helping.
Yeah, if I can also add to that one quickly, I see that the times is up, but technology is helping in multiple ways, especially artificial intelligence. Look at what DeepMind has done for the protein folding. That was a mystery that science was not able to solve till date. Today, DeepMind has been able to predict that protein folding for 95% of the human proteins with more than 95% accuracy. This is going to, transform the way medicine. So we are getting into a precision medicine era. And the other thing is the mRNA technology that was developed. All the kinds of vaccines that were developed, these are all bioinformatic vaccines. So it didn't go through the, traditional cycle of research. That is the reason we got it in less than a year. So, technology is not just, mobile, but, it's also playing a vital role on the other side. So I just want to add.
Dr. Mahajan, your last words on this?
I would just say that it's not technology for technology's sake. Technology and adoption happens only if it is useful on the ground. And we've seen that during the pandemic, and we will continue to see it as we go forward.
I remember I used to work at Google, and one of the things that we used to keep in mind is that build something which is usable and useful. And that is when the adoption will happen. With that, I thank you all for taking our time to be with us today. I think this conversation for me has been very, very useful, and I'm sure the audience would have resonated with every word that has been spoken here today. I thank you so much from the bottom of my heart, sir.